What would you say to that person who's like, I feel something, I heard something, I'm nervous about going to a doctor? How would you encourage them to kind of get over their fear so they can prevent something that could be worse down the line?
I think the first thing you mentioned is rest, and this concept of rest doesn't mean inactivity. It means stopping and pausing, thinking, developing a plan for action. So rest does not mean inactivity. I think that's important. It doesn't necessarily mean taking a nap, although a nap would be lovely. And then I think what I'm finding more and more is somebody who has a practice that is built on spending time with patients. I hear this all the time from women, particularly young Black women suffering with uterine fibroids, which is what we do every single day at our center. They often have chronic fatigue anemia, and this applies to many different medical conditions, not just fibroids. But they're looking for somebody to just stop and listen to their story. And when they take that moment to then recount to us, I've been dealing with this for 10 years, it's a moment for them to then reflect on, wait, what have I been doing for 10 years? Why have I been struggling with this condition? Why have I not taken action yet? And so this session itself with the consultation becomes this sort of introspective look into their own health. And that is the rest moment. And I think whether you do that at home or you do that with a physician that you trust and that you admire and that can counsel you, maybe it's not a medical problem I even deal with, but I hear about it from the women and I guide them. And you need to surround yourself both internally and externally with people that are going to listen to you and take the time to process those challenges that you're facing. Because we don't have all the information. I certainly don't have all the information, but it's out there. It's out there in one way, shape, or form, whether it's ChatGPT or a friend who's also suffered with, say, uterine fibroids or some other condition, or hair changes or skin changes. Maybe it signifies an underlying disease. But if we don't have these conversations, then it just becomes a silence and you don't recognize it. And I think that is a really challenging part of so many of the medical conditions that we see, particularly in our practices. Women are struggling with these things. They're literally having to leave work because of, say, a heavy period, or they're in so much pain, or they can't go to this conference because they literally are in so much discomfort. And yet, what are they going to do about it? Until they start talking about other people and realizing that this person is affected by it. I've already met 5-6 people here who are affected by uterine fibroids. They're everywhere. So there's people all around you. We need to erase the stigma of disease. We need to be talking about these things. And they may be uncomfortable topics, but it's important.
No, I